Ever had one of those patients with vague hip pain? One minute it's the hip, the next minute it's the back, then it's the leg, and suddenly you're sweating bullets thinking, am I missing something serious? Yeah, those vague wandering complaints are an unwelcome monkey wrench on your busy clinic day. And here's the part nobody tells you. It's not the patient's fault. It's just that school wanted us to have a perfect diagnosis, but what we really need is a system. So let's ditch the pressure of perfection and focus on what works. In this video, I'll share a practical system to help you navigate these tricky cases and get your patients moving forward. I remember chasing the diagnostic labels all over the shop. I was convinced I was missing the real answer. But here's the thing. Chasing labels doesn't calm the doubt. It makes it worse. Back when I was in school, we didn't even have half these diagnoses. I bet you in 20 years, we'll have twice as many. That's the rabbit hole that never ends. I'm a systems guy. I love lists, and having a system, well, that's the cat's pajamas. You go from second guessing yourself to walking into the room with a plan. And your patient feels that shift too. They don't want you chasing butterflies. They want you steering the ship. I need that system, you need that system. That's why we're here. In this video, I'll share my framework, the one that turns uncertainty into effective treatments, spotting the red flags, decoding movement patterns, and building active exercise programs that work. And yes, there's one more bonus idea, but you have to stick around to the end to hear it, unless I've already spoiled it by putting it in the slide. Yeah. Major idea number one, screen hip pain for red flags. Physios have to think safety first. Ever had that hip patient where it hurts here, it hurts here, it hurts here? Vague symptoms at the hip come from anatomy. It's a deep joint. It's got the back and the pelvis right next door. So where do you even start? Start with the basics. Rule out red flags. I think school should start by teaching the triage of red flags and signs of serious problems. Ever had that red flag moment? Share in the comments below. Maybe somebody can learn from your experience. This is my story. I once had an older lady walk into my outpatient clinic with vague hip pain. She walked in fine, no apparent distress. Honestly, she looked like most every patient you'll see on a regular day. Easy peasy lemon squeezy, right? Then she said something that stopped me cold. Saddle paresthesias. My stomach dropped. Everything else looked routine, but that one detail flipped the whole case around. So I wrote a quick note on my business card, rule out Cauda Equina Syndrome, and sent her straight to the ER right next door. In the end, it wasn't Cauda Equina Syndrome. She had another medical issue that got managed. But here's the point. I didn't need to be right about that diagnosis. I needed to be sure that that patient was safe. That's the lesson. Sometimes the patient looks fine, but one red flag question changes everything. Your job isn't to be a hero with the perfect label. It's to be the safety net that catches the rare but serious stuff. Patients trust you more when they know you're looking out for them. So unlike all those quick, fixed YouTube videos with magical mobilizations or fancy stretches, your first consideration must be safety. Shift your mindset. Your initial role is triage and your patient's well-being, not shortcut solutions. Think safety first. Slow and steady wins the race. I know everyone is in a rush nowadays. The promise of creating an Instagrammable, TikTok-worthy viral short is tempting, but patients will see that you've got their best interests in mind. You're on their side. You're not just here for a quick buck. So these are 3 steps to keep in mind. 1. Always ask about red flags. You're not alone in this. It's okay to refer out. Sometimes that means sending a patient for a medical consult. Sometimes it means checking in with a colleague for a second opinion. Trust your clinical sense. Trust your spidey sense. It's there for a reason. Remember, we're physiotherapists. We're not the emergency room. Our role is to keep our patients safe, and part of that is knowing when to pause and say, wait, what's going on here? 2, when in doubt, leave it out. I see so many physios eager to put their hands on patients or fire up some fancy electro gadget. But here's the thing. We need to start by not by making things worse. Before I dive into the whole active versus passive debate, let's look at it from another angle. Patient-generated movement. When a patient moves actively themselves, they overcome that fear of movement. Start with gentle, active motions. That's where confidence begins, and that's where the patient can repeat this at home without me hovering over them. That's independence. So start simple, start gentle. Let the patient move themselves. All those shiny machines and complex manual tricks, well, when in doubt, leave it out. Safety first every time. 3. Documentation is your defense. Chart that safety screen carefully. If you've seen my first book, you know I love a good checklist. Good notes don't just tick the boxes. They tell a story of what happens. And that charting doesn't have to be your nemesis. It's part of the job, and with the system, it becomes second nature. Even if it's not a billable visit, you can still document, keep notes, even outside the formal medical chart if needed. That way, whatever happens, you've got a record. Protect yourself. In the middle of chaos, you get tunnel vision, your heart is pounding, and your memory goes blank. The only defense left is the words you put on paper. So we've built this safety net. We're keeping it simple, patient focused, and we've got the documentation. So now let's zoom out, because physio isn't about paperwork, it's about watching patients move. I love watching how people move. That's where the puzzle starts to make sense. Major idea number 2, stop chasing the diagnosis labels. Functional movements give better physio outcomes. Vague symptoms at the hip come from anatomy. Remember that? Start with the basics, rule out red flags, and that leads us here. And everyone wants a clear diagnosis, but realistically, after all these years in physio, you probably won't get a solid diagnosis, except hip OA, especially if they have gray hair. So rule out the red flags and then move on to functional deficits. After all, the key is function. This is the kind of thing I wish somebody had told me earlier. I've worked with some brilliant physios who love trying special tests and poring over imaging, but often it felt to me like they were chasing butterflies. Let's call it the diagnostic tunnel vision. It's when we get so caught up in solving the puzzle, we lose sight of the bigger picture. I get it, playing detective is exciting, but this isn't about proving how clever you are, it's about helping your patient and improving your patient's function. So let's put this into action. I have 3 strategies to cut through this noise. 1. Simple functional testing is where it starts. Sure, do your evaluation, ask your questions, check range of motion, manual muscle testing, and let's be selective about special tests. Tests like Faber or Fadir can be uncomfortable for the patient. Do you really need to put your patients through that ouchie moment? I'm not convinced these irritating tests change your physio treatment plan. So let's focus on functional tests that matter. Watch your patient squat, assessing depth and symmetry and alignment. Check their single leg balance, noting control and stability. And don't forget observational gait analysis, looking for compensations like a trunk lean or an antalgic gait. These are simple tests that work across settings, home care, inpatient, outpatient clinic. 2. Objective measures bring clarity to the pictures. By quantifying what you see, we can rely on the data rather than guesswork. I like measuring walking speed by timing the patient walking between 2 landmarks, or you can use the timed up and go, the tug test. This article gives you a formula for walking speed from the tug test results. There are other scales for the hip, but I find them less intuitive and I'll only do them if I have to. Objective measures help you remove bias and give us a clear picture of our patient's progress. 3. When patients are part of the solution, everyone wins. Work with your patients to set short-term, realistic goals that actually connect to what brought them in. Teach them how to track their own symptoms, notice trends and triggers and warning signs, and most importantly, help them identify what works and what doesn't. When you plan together, you're not just treating symptoms, you're building ownership. They came to you for help, but the real win is when they can leave knowing they can help themselves. You've done the groundwork, safety checks, functional tests, objective data, and shared goals. Now, instead of chasing butterflies of anatomy, let's plant the garden that keeps them from flying back. This is active care, where the patient takes the wheel and you're the navigator helping them steer towards better movement and brighter days. Major idea number 3, active physio builds patient resilience. A vague diagnosis doesn't mean vague care. Think of it as like driving a car. If I stopped for directions every time I felt lost, I'd never get anywhere. The key is to keep moving forward. A vague diagnosis doesn't mean you're lost. It just means you don't have a detailed map. And for those of you who have never used one, a map is what they used in the olden days. It's like a printed version of GPS. That's part of the problem with physiotherapy nowadays. Too many PTs are heading off in different directions without a clear sense of purpose. We don't need another TikTok challenge or Star Trek tricorder device to magically heal every ache and pain. What we need is to come back to what physiotherapy is really about, helping patients improve their lives. Active rehabilitation is the backbone of our profession. It takes the uncertainty and turns it into a direction. It shifts the patient from dependency to resilience. Patients don't need you to help identify every structure in their body. They want you to give them confidence, to help them move better, and craft a plan that they can follow. That's where active exercises shines. It gives patients the tools to drive their own progress, and it defines you as the physio who builds the independent instead of dependency. But the biggest trap here is leaning too much on passive treatments like manual therapy, hot packs, or those electrical magical widgets. especially when the diagnosis feels unclear. These shortcuts are tempting because they rack up billable hours and give the illusion of control, but the relief doesn't last. They build patient dependency and they delay the real long-term solution, and they leave people chasing temporary hacks. I know because I felt for this early in my career. Patients felt better for a short time, but then they stopped coming back when nothing really changed. Shift the focus to active care using my simplified approach to physio. Instead of chasing the perfect diagnosis, you need a no-nonsense categories that are useful to drive patient care. And this goes with effective real-world treatment approaches that you can use for both you, your team, and your patient to clearly understand what's going on. I go into more detail into this video here, but here's the quick overview of my 3 simplified diagnoses. They ask, is the problem traumatic? Is it overuse? Is it systemic? And the 3 treatment stages that go with this are just as clear. Pain management, regaining motion, building strength, balance, mobility. This framework tells you exactly what to focus on. You know where you are in this case. Your patient knows where they are in this case. This can help you if you're like covering somebody else's patient all of a sudden. Some clinics use this shared caseload model, or maybe you're just trying to give a second opinion for somebody. This kind of clarity builds trust, and when you layer active exercises into every stage, you don't just reduce symptoms, you help your patients build that lasting resilience we talked about. Here are 3 actionable strategies that I use with my patients. 1. Passive treatments are the side dish, not the main meal. Use manual therapy or modalities briefly, just enough to reduce the pain or unlock the motion, then move straight to active exercises. Passive care should support the active recovery, not lead it forward. Think of passive treatments as Robin, not the active Batman. 2. Graded exposure with simplified staging. With graded exposure, patients voluntarily, step by step, reintroduce movements themselves. Even in the early stages of pain management, patients can start with gentle, pain-free range of motion to start active motion without aggravating symptoms. The key is pairing this with some hurt versus harm education so patients learn that some of this discomfort isn't always damage. And in recovery of motion stage, graded exposure helps patients ease into those restricted range of motions safely by providing movement that isn't dangerous. And in the strength, balance, mobility phase, the graded exposure becomes progressively loading functional tasks like squats or lifting or single leg balance, so the patient rebuilds confidence and function. Done well, graded exposure turns fear into progress and gives patients the belief that recovery is both safe and achievable. 3. Keep homework simple. Don't overload patients with long lists of exercises. Instead, give them maybe 1 or 2 key exercise movements that fit their diagnosis category and treatment stage and that tie back to their functional goals. This makes the plan easy for them to follow and builds buy-in and reinforces that recovery, which is something that they drive, not something that you're doing for them. And you've made it this far. Congratulations. You've officially unlocked the bonus round. Woohoo! Bonus section. Physios aren't about perfect diagnosis. It's about improving patient function. Here's the reality I wish I had known earlier in my career. Uncertainty is the norm in clinical practice. As I mentioned in my last video on anti-fragility, patients don't need a perfect diagnosis label. They need a clear functional plan and a physio who can navigate complexity with confidence. The truth is, every patient story and presentation is unique and often messy, and that's just the nature of the job. I once told a patient, I might not know exactly what tissue is involved here, but I do know how to help you move better, and I've got a plan to keep you safe as we do it. And that really helped relax that patient. What she needed wasn't a diagnosis, she needed a direction. And that's what we talked about earlier with my simplified approach to physiotherapy. Have a direction, keep it functional, and don't make things worse. Here are some reframes that you can use right away. Instead of chasing that perfect diagnosis, point the conversation into a more useful direction. Try saying something like, let's find movements that feel safe and build from there. If something feels uncomfortable, we'll adjust. If it hurts, we'll pause, check on things, and keep trying. It's about small wins. Add a little more than last time. This movement might feel a little tight, but tight doesn't mean broken. We'll load this gradually so your body learns it's safe. Your job is to keep moving, not pushing through the pain. It's okay if it feels awkward at first. It's your body relearning. Every rep tells your body that you're safe to move. This language gives patients clarity, lowers fear, and builds trust. So here's the takeaway. Uncertainty isn't a failure, it's thinking. If you wanted certainty, go study mathematics, because physio and medicine in general is all about coping with uncertainty, incomplete data, and human variability. So the solution isn't another imaging scan or a specialist consult. It's about function-focused care. It's about clear communication. Become the physio your patients can count on. Now, let's tie this all together before your coffee gets cold. So the next time a tricky, vague hip case comes and leaves you scratching your head, don't panic. Remember, start with your red flag firewall. Keep patients safe. Lean on functional tests instead of chasing pathoanatomical phantoms. Patient function is key. And build resilience with active care patients can actually own. Simple home programs that they'll stick with. And the bonus twist, you don't need to be perfect with your diagnosis to earn trust. Honesty and function go further. Reframe your patient into a more useful direction. Remember, you don't need all the answers. You just need a plan that gets your patient moving and confident again. Because that's why we're here, right? I'll see you in the next video. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Buckle up, because this video is a wild ride. And by subscribing, you'll be part of a community that values growth and knowledge. Thank you.